So I want to ask you, because one of the things you hear commonly is that pronouns are a struggle for people. And there are lots of pronoun options out there. How do you, or what wisdom do you give people who are trying to use they, them pronouns, or some of the more newer, more unusual or less frequently used pronouns?
Sure. I mean, that gets hard because certainly where I work, we are incredibly diverse. I have staff from everywhere all over the world. Yes, I have some staff that were native, here as born American citizens. I have staff from India. I have staff from Uzbekistan, the Philippines, China, Taiwan, Japan, literally all over the world. Some other languages don't even have pronouns. So you get staff that aren't used to using that, and then, they've been trained for however many years that they've lived here to use he and she, and now you want them to use something different. So it can be hard on staff if it's not their native language, first and foremost. Then you have age gaps, generational gaps. Certain generations have an easier time with it just because it becomes part of their everyday language. So making sure that we create a learning environment for people, number one, that we track all of our misgendering events. We do it as an event report, and we track it as a quality metric because it does cause harm to the patient. So we want that to be minimized, and we don't look at it as punitive when we track it as an event. It's a learning opportunity, unless of course somebody is doing it in a very derogatory way and refusing to learn. That's a totally different discussion. But most of my staff, if they accidentally misgender a patient, it's completely unintentional and they feel terrible about it. So we use it as a learning opportunity. I find that a lot of people who come to work at our organization are really proud of that program. And particularly my perioperative departments are probably the best in the entire hospital about it because we see the biggest group of patients. A lot of our patients are outpatient, which is also really tremendous because we literally do top to bottom gender affirming care. We do every kind of procedure you can imagine, and then some you can't. It really is whatever the patient, feels that they need. So getting staff involved with that is actually kind of easy. They see the outcome of it and how people feel so validated and seen, and that's infectious. It's a great culture. It's always interesting because just this week we've had surgeons even from other specialties, orthopedics, also general surgeons that have seen my gender surgeons just recently because we are talking about a lot of stuff, especially with some of the work that I've been doing and trying to advocate outside of my hospital because that's a big part of this. We've been talking a lot, and so they're like, oh, tell me more. They're talking to other surgeons, and can I come and watch your case? Can I see what's going on in there? Just so I have a better understanding of it. These are doctors that, would never be doing bottom surgery, but they're curious because they want to know how to best care for their patients. They want to advocate for it in a way, and learn. They're intrigued by it. They're new surgical procedures that people aren't doing everywhere. So,
and it's interesting because I think when you talk about gender affirming care, everybody immediately goes to bottom surgery.
Yeah.
And there's so many other surgeries that potentially that you don't know what the reasoning is. I mean, patients can have mastectomies, they can have breast reconstruction, hysterectomies,
absolutely.
orchiectomies. There's so many surgeries that can be for malignancies, for aesthetics, for whatever.
Absolutely. I mean, when it comes down to it, there's a plethora of them, and sometimes they are simple. And a patient just wants a mastectomy or chest reconstruction, and then that's it. Some people do vocal cords. They'll do shortening, lengthening, pitch change, elevation, and all sorts of things. Those are gender affirming surgical procedures. It's not all bottom surgery. And honestly, it's interesting because the diagnosis is gender dysphoria. And they're updating it right now with some of the newer, we get into what is the insurance code versus the DSM, diagnoses of condition. it's all very semantic language, but for now, go with gender dysphoria. So I was talking to a patient, actually wasn't even a patient, it was somebody out in the community. It happened to be my massage therapist who happened to be trans. And I was telling her what I did, and we started discussing. She felt safe enough to share, her feelings about it. And she said, I'm not ready to do certain procedures now because I'm only looking for things that create euphoria. I don't want to treat the dysphoria. And I think that's a really important piece to consider. Instead of looking at the negative of a condition, let's look at the positives. So instead of saying what causes you dysphoria, let's start asking them, what will give you euphoria? What's going to make you feel whole? It is the most important aspect of my job, that I get to help people feel that good every day.